No insurance presentation or discussion would be complete without some, actually, disclosure. The opinions stated here today are those of my own and not that of my employer, which is AIG. So we've got that out of the way.
Yes, okay. I will also take a chance to, moment here to do the disclaimer. Disclosures. You say tomato, I say tomato. All right, so yes, these are our own opinions and not of any companies represented here. And we're going to try and, it feels silly talking with this microphone, but
I need it.
The question is, first of all, to always ask the audience, is anybody working on any insurance things currently? Are you thinking about it? Anybody developing? Okay. All right, excellent. And the reason I ask is that, yes, we are not representing the insurance industry. We are from The Fainting Goat Farm, and you can reach us at thefaintinggoatfarm.com, where there are fainting goats who are not insured, however. And so, but we'll hopefully address any issues. Now, normally at Barcamp, there's a very calm audience and nobody speaks until the end. It's quite all right to heckle here during this session.
Yes.
And so if you have questions, just speak right up. Just jump right in. It will be just fine. It does not matter at all. In fact, it will be a much more enjoyable session because of it. So, to move on, we have, is it working?
Haters gonna hate your computers.
Excellent. Okay. Has anybody gone online and seen the healthcare.gov site? Yes, yes, yes. Has anybody seen the healthcare.gov site on television in the last 2 or 3 weeks? Okay, all right, all right. And the reason is, of course, the implementation, the actual concept turning into tactical. It creates problems, and so. We're going to address some of those today, some of the issues that are part of the problem with insurance in general and working online, and hopefully get to the bottom of why haters are going to hate all the time. And number one, we can go back to that just a minute. I know those of you who have seen the healthcare site online have usually seen the woman's face on here. I don't know if you happen to notice, but there was a significant, large change in the last couple of days where they have in fact put some icons on here.
Were haters hating?
I think they were hating, not necessarily the woman, but I think they were hating the fact that they couldn't get to these places. And now I'm pretty sure this stands for apply by telephone, right? And I'm fairly sure this means apply online. Anybody know what this means? Want to take a guess? What do you think this little...
In person?
Group insurance.
Ask your friends.
Group insurance, hey, that's an idea. Yeah, it could be. Maybe it's social media, perhaps, or it's
phone a friend.
Call a friend. Yeah, that's it. Yeah, you've got your lifeline. Yeah, phone my lifeline. That's what that one is, right? And this here, I believe, is printed out and use a pencil to write it like an old
fax it in.
Normally. Fax it. That's probably exactly what this is. So the question is, why would they have replaced the lovely branded woman's face, who is obviously the face of the affordable health care, with these particular icons? Anybody want to hazard a guess? Well, the answer is, I don't know the answer to that either. I would just be guessing to tell you, but my suspicion is it had to do with user interface design. So, and does anybody here work with UI or UX? Okay. If you are, in fact, designing for health insurance or any kind of insurance online, one of the critical factors is the flow of information. And so I would suspect that they had difficulty, people did, with the first iteration of this, finding exactly where to go. They had some other difficulties with this. In fact, if you had tried it, you would have had a difficulty because you might, for example, want to shop for prices without necessarily giving all of your information, including the place you were born, any prior medical information, doctors, prescriptions that you're on currently. The list is rather extensive for the information that was asked prior to actually being able to get a quote. one of the things that's going to be happening in the next 3 weeks is that the cavalry has arrived. So Google, Red Hat, and Oracle will be coming in and sending in people, volunteers. I suspect they'll probably be paid as well, but they're coming in to make some changes, to make the fixes, to create this better flow. And bottom line is they're designing it not like an insurance carrier, from the insurance carrier point of view, which would mean that you'd want to gather as much information as possible, absolutely, because that helps in underwriting. It actually makes it a lot easier and mitigates the insurance carrier's loss, which is how the insurance carriers make profit. And the question is whether or not there should be profit in healthcare. Regardless, we're not going to touch the politics here, but the point is that by designing it instead of from the insurance carrier's point of view, but from the shopper's point of view, which is, I believe, what this is moving towards, and what certainly Oracle and Google and Red Hat will be doing, there will, in fact, be much better conversion and a lot more than 6 people a day being signed up for this. So the good news is, on the horizon, if you're interested in seeing the success of this, it's probably coming. And it is going to be coming as a result of changing the user base interface and the user experience designs. And that's part of what we're going to talk about today. So the next piece is that this is just one form of insurance. There are many forms of insurance which people are moving online now to purchase. And there's a reason that these forms of insurance are different. So for example, on the left, all the way around, if you go counterclockwise, from home to travel to accident to auto insurance, that is a more ancient form of insurance. These are the types of insurances that were around 2,000 years ago, when traders insured each other's ocean cargoes because actually it was lost quite a bit more than it was in the past than it was now. And so it gave rise to this type of property and casualty insurance. The life insurance, as we know it today, is far more about financial planning. If you run out of money too soon or you live too long. So it is in itself a different category of insurance. And health, entirely different, I believe, from all of these. And the question, again, as you ask these things, not only delves into programming user experience issues, but then also ethical issues and political issues, and you question whether or not health should be a profit, and perhaps some of the problem has to do with that, and also the naming of it. So, for example, instead of the Affordable Health Care Act, it should have been the Affordable Insurance Care Act, because that's exactly what has happened. Now, I'm going to take just a second and go back to saying here. There probably is a solution, a simple one here, and somebody suggested it actually on the Barcamp discussion group the other day, and I thought it was brilliant. So the idea is, you can get pre-filled information from databases, and insurance companies commonly do this now. If you put in your name and your address, they can look up your DMV records, they can respond with, they know which cars you have, that sort of thing. So it would actually be possible, if they were able to get the NSA to just simply pre-fill all the data for us, with all that information they've been gathering on us over the years, then we would have a far easier time of it. And so, yes, I thought that was a brilliant solution, and perhaps Google and somebody or the other will suggest that. And now, haters gonna hate is not something new. It's not. This has been a problem for quite some time. If you look at the traditional forms of insurance, people have always misunderstood risk aversion and risk mitigation. And in fact, this gives rise to jokes. And it's true that in comedy, there is always a measure of truth. So in this little comic here, where he's asking the seat to stake, yeah, you can see the dread in the poor man's eyes, who is going to face sitting with that insurance agent, and start with that inevitable question: have you examined your policies lately? Well, we don't certainly want to translate that to the online experience, because that would simply be carrying on from generation to generation the hate that was engendered by the initial necessary form. But really, again, it goes back to, would people buy insurance if they didn't have to or need to, or if they didn't understand the risks, right? Well, no, people don't buy things if they don't have to, which is why, of course, there's the requirements for fire insurance if you live in buildings, there's requirements for automobile insurance if you're you buy an automobile, the government, all of us, we together, are ensuring that we are mitigating our risks by actually having some form of insurance or risk management. So the question is, when we move online, can we eliminate this? Are there frictions in this traditional model that we can get rid of, because we're absolutely able to do this through digital means? And through the UI and the UX design, I believe there are. And I believe that there are a number of ways that these are eliminated. Now, this is a standard model of how traditional insurance companies approach currently the idea of moving online and eliminating the friction in that. There are some key elements that are still a part of the normal insurance buy. There is an insurance company, and there is a consumer, someone who is, or a company, corporation, seeking that insurance. The traditional side is that a consumer spoke with an agent who then arranged the insurance and made the contracts, and the premiums were paid to the insurance carrier, and then the insurance carrier, in the event of loss, paid the benefits to the insured. So here in the online model, we see that there's a few other elements that are added. Consumers do buy directly from insurance carriers' website. Has anybody used Progressive or Esurance or Geico or any of those online? All right. So if you have, you know that you don't necessarily have to find them specifically through an online agency or an agency website. You don't have to deal with an agent. You and the insurance carrier are having a direct relationship through the online. How you may have found them, there's a number of ways. One, it's amazing, even though this is online, the reliance upon traditional media. So those insurance companies spend a tremendous amount of money on traditional television advertising. As an evidence, if I were to name one of those carriers, like the General, for example, could you sing the jingle for me? Anybody know the General's jingle? What is it?
1-800-GO-GO-GO.
Hey, all right, close enough. Well, see, that's close enough. At least he knew where to call. So, most important is their money's well spent in that those people who are searching at the point in time that they are looking for insurance do have an idea where to go. If they do not have an idea where to go, search engines, of course, playing a much larger role now. Companies buying keywords and that sort of thing.
Social media.
Social media is involved in this as well, part of the SEO crisis, calculations. Yes, it's a crisis. Believe me, it's
Everything's a
crisis.
crisis.
It's a crisis. Yeah. An informative website, content management. Anybody doing content development? All right. So if you do content, you know that drives the SEO and allowing people to find it through marketing means. Anybody know what a lead aggregator is? I'll explain this really quickly. If you go to a website that has multiple carriers and offers you lots of different choices of policies, this is what a lead aggregator does. And there have been, in the last few years, an uptick of these, and in fact, now Google is trying to get into this space. So Google recently announced that they are going to be replacing their sponsored ads at the top of search results with, in this case, aggregation ads. So there will be a box there that will allow you to put all the information in that you would normally put, like your zip code and your car type, and then Google will offer what the lead aggregators do now. They will offer you search results, but those will be branded search results, and those will be all of the carriers who want to respond to your inquiry for their business. So it is a very effective model, and very important to remember, especially if you're doing UI UX design, is how can you make that seamless? How can you make it without friction? How can you bring this to fruition and understand that lead aggregator part is very key. The other part that is still involved, and I'll point to it down here, an online agency or an actual agency website, there are, of the people who come to those Progressive, Esurance, Geico, a certain measure who will not be resolved with just the online. They'll have to speak to an operator. That measure is pretty large. It's somewhere between 40 and 60% of the people who actually, when they start searching online, end up speaking to an individual. So the human factor is not yet completely dissolved and might be a factor in the healthcare.gov site. When you are designing for these types of programs, the other real critical factor to remember from a user interface standpoint is that this is just the front end. So if you're really thinking about a strategic design for an overall site, you cannot exclude the back end. And this is where insurance carriers make the majority of their profit, is by controlling this loss in somehow. So you've maybe heard it before, large claims departments, their real responsibility is not to pay any claims, and so they do their best to avoid paying it. In practical application, this is probably what occurs. The way that it's spoken about is not that way, of course. They're servicing policyholders, they're of course paying the claims that are necessary to be paid. They're just not being overtly, well, they're not paying claims willy-nilly. They're certainly investigating them as much as possible to make sure that they're legally responsible for doing it. So when you're designing the front end, important to know that it's not just the user, the consumer part who will be interfacing with your systems, but in fact the people and the individuals who are still required to do underwriting and claims management on the carrier side. And this will require the same sorts of access to databases and the same sort of frictionless flow, or taking the friction out of the flow. Insurance carriers who have done this well have managed to automate between 70 and 80% of this process. So previously, all human beings, all touching these claims process pieces, determining the reimbursement, determining the status, advising the clients, paying the claim, recording it into some kind of databases. And now, the majority of these, those who are going to be profitable in the next century or so, are making certain that their entire system comprehensively works in a cohesive manner, sort of a universal design. So both the front end and the back end take away that friction, make it as simple as possible, and of course, as that is done, it increases the volume, increases the conversions, increases the profitability of the insurance carrier. So, regardless of this, haters going to hate. So there will always be dissatisfied people, either with the flow, or with the process, or with the result of the process. And there are perhaps ways to mitigate that. I'm going to let Michelle talk a little bit about the social media piece.
Yes, so he gets to stand behind closed doors and take that hate, but I get to stand in the face of the public and take a lot of that hate. How many in here are working on social media or marketing for a highly regulated industry? It's really difficult, isn't it? It's not impossible, though. You got to get the right people on board. But as you can see here, we're taking a lot of heat and receiving a lot of hate, not only from consumers who have issues with policies and whatnot, but also from the regulators that we deal with. Digital suffers a lot from the processes that are required in the regulations that we have in place for like archiving and monitoring and supervision and advertising regulations. And here you can see an example of how a broker was fined for some violations in his YouTube video. We take this stuff very seriously. But it's not just a matter that's happening there with the digital channel of communication. You can also be fined for misrepresenting certain activities on traditional sources of media as well. So you've got the regulators that are hating on you all the time, and sometimes the consumers. So we'll talk about that for a minute. I want to teach you or show you ways to enable rather than to disable the use of social media in a compliant way. So why bother even trying when you have so much, regulation and red tape to go through? I mean, it is a very difficult position to be in, especially when you don't have the right people at the table to have a conversation about how to enable. But the consumer is in control. You can say, no, Mr. Sales Agent, you can't have a Facebook page, or, you can't engage. But we've seen where, and this is good, this is really good, the consumer wants to have a conversation with those people who come into their home and sell them a policy, the people who they grow to like, and they'll friend them on Facebook. So what do you want to do? You want to participate in the conversation, oversee it, and manage any customer expectations that exist, or do you want to put a blindfold on and ignore it? The conversation is happening with or without you. So how do you mitigate the risk? How do you mitigate the hate? So even with, the inability perhaps of the consumer to come to you directly as a brand or an entity, a corporate entity, or to your agent and express their dissatisfaction, the conversation really is going to happen with or without you. And more, the consumer is going online for these certain life events that are happening, the life events that trigger the purchase of, in my case, life insurance or some other financial product designed to protect your assets. And they're asking the question about who to buy from, and they're leveraging their friends and networks and social networks to make those decisions. So, the more that you can positively engage with your audience, even for your agents, the more opportunity you will have to convert or to endear that consumer to your brand, create the brand affinity and the brand preference, so that when it comes time, they will make that decision to go with your company or choose that provider. So the challenges, as I said earlier, of social media, I think the biggest challenge, of course, we have the regulated environment to deal with, but really this will become easy with some of the technology platforms that are out there and with the right people at the table. But you have to be looking out for the customer. Without the consumer and the customer, you've got no business. Okay, so really, they are key and critical. You need to have processes in place to listen to the conversation, to make sure that the needs are met and to engage the right audience, so that when a concern comes and surfaces up, it is handled, and it's handled in a quick manner. So you need to start training your staff across the board. You need to have marketing, PR, customer service, and in our case, legal and compliance at the table. You need to enable these people to get out there and engage. And you need to have technology platforms in place in order to make the responding to these situations, or even to listening and having those issues surface, facilitated in a manner that you can respond quickly. So how do you do that? Let's talk about that for a sec. So I've actually evaluated all of these platforms. We've got a platform called Socialware that helps enable, and they're at different price points. Listening and engagement in a compliant way, it satisfies the archival requirements, the supervisory requirements, and it also controls through toggle switches, if you will, what an agent or a brand can and cannot do on different social platforms. The same is true for Hearsay, Social, or SunGuard Protegent. And then for the enterprise level, you've got a brand or a product service called Sprinkler. Depending on where you stand with what you want to pay, you could go from the Cadillac, I would say, is Sprinkler. The next one would be Hearsay Social. And I know that there are a lot of people who are migrating from Socialware over to SunGuard Protegent. SunGuard Protegent is the entry point, I believe, for any of you out there who are looking to start pushing out the capability or to enable your audience to compliantly engage on social media. But you got to start with the training. You need the skill set in place. Your customer service department needs to know, Twitter is 140 characters. That's kind of hard to, respond. And then you got to protect against, the privacy policies and the HIPAA violations. And watch out for people exposing their social security numbers, because it happens, believe it or not. I've seen it. But somebody needs to be listening, and so you need really a team on board to make this possible, but it's possible. So get it together. Start with checking out your policies. And I don't mean policies in the term that we speak of in insurance. I'm talking about your social media policy. Is it designed to be restrictive, or is it designed to enable? Develop guidelines for use. And you can't enforce use of a compliance program if you haven't written that into your policy. So take that into consideration and start there. Form your teams. Engage your PR, your marketing department, your operations even, because there's going to be times when a letter is sent out to your customer base and the phone lines are going to go crazy, And you know what happens when that happens? Phone systems go down. And you know what? First place they're going to go is to Facebook, Twitter, and they're going to start complaining, and you need to be engaged with them. And then you can give feedback to them so that they can start to design or to improve operations internally. Get your staff trained. Train them on a social media 101 so that they know, again, Twitter is 140 characters. It's really hard to use that. Or how they represent themselves on LinkedIn. Come on, people. Nobody likes just a standard icon on your profile picture. Or, LinkedIn is probably not the place to put your kid's picture as your profile picture. So, there's huge opportunity there. And you would be surprised at how many people just don't have that skill set. But it needs to be trained. Social is becoming everybody's business. It's not going to be a digital department. It's not going to be a social department. It's going to be everybody's business. In the insurance industry, business has always been social. We just have a new channel. So back to the channels now. Select your channels. Where are you going to play? Select those channels. Train your staff, and then do it well. And then, design your content so that they have something engaging to talk about, something shareable, and allow them to tell their personal stories. That's the great thing about the personal stories. When you can talk about life events, or say, for example, I coached a Little League soccer game today. That's really growing your network. That's endearing people to you. When you start to talk about products and services, that's where we get into the real nitty-gritty, difficult thing to do, because all of that stuff right there is highly regulated. And you know what? You would go to a cocktail party and just stand around and talk about your products and services. Everybody's going to be like, talk to the hand. Talk about haters. So get it together. Select the right tools. I showed you a few tools that you can evaluate on your own and at different price points. So figure out where you are and what you want to do. And then start to get those tools into place for your field to use, or even your brand. And set up your listening program. And then empower your staff. Your customer service is the most important. Not the most important, but if you don't have somebody engaged in customer service who's going to be listening and helping out the customers, you're doomed to fail. I mean, you're doomed to fail. Connect on multiple channels. So when you have a complaint that comes in, be sure you know the chain of command, and then start to engage with the consumer and give them phone numbers, give them the ability to email you. Be ready with a thought-out plan of action for how you're going to do this. And then prioritize. Depending on what size your company is, it might be practically impossible to respond to every complaint. But if you got the right tool in place, you can start to decide who's the influencer that requires your attention, who's the hot item. And then automate where you can, what you can, but don't automate the humanity out of your business. Meet your customer expectations. The customer is key and critical. If you don't have happy customers, you got no business. And don't be a stalker. Use etiquette, people. Don't be listening to conversations and just jump right in and say, hey, buy my stuff. Oh, no. Use etiquette. That's the NSA's job. And then take your analytics that you can gather through these platforms and use it, the customer insights, to inform operations, to inform marketing, and inform product development even. So lots of information for you to gain from there. Once again, my name is Michelle McManus, and I am officially a representative of the Fainting Goat Farm, and you can email me at michelle@thefaintinggoatfarm.com. I'll be happy to answer your questions. And I think we'll open this up to Q&A since we have just a few minutes left.
Anyone question on any aspect of insurance? UI, UX, social media? Yes, sir.
Is there anything that's clear about HIPAA and its effect on using mobile, tying in with health records, all that?
Absolutely. HIPAA regulations are fairly clear about what you can and cannot reveal, and what you can and cannot do. And usually, and now originally meant for medical records primarily. Now, doctors' offices, hospitals, any kind of care provider has to adhere to HIPAA regulations. How it affects the insurance industry is in the health arena. that top one. Where there are medical records being exchanged, those same rules apply. So not revealing, not releasing records, having proper signatures and disclosures if you have to transfer records from one area to another. Same regulations that medical providers must adhere to. Also health insurance carriers, or those health insurance conglomerates that actually have, so for example, HMO type of information, has to be handled the same way. So those are the same regulations that apply. How to get those? There's many companies now who are actually building their entire profit model on training and education and guidance in HIPAA. And some companies will come and do audits and straighten out your processes, much like a security audit would. Yes, sir.
That's why Google doesn't have that rate thing for health. So they can't quote rates yet. It's only in auto insurance. I think it's only in the UK. So health insurance is very hard. You can't even quote, like our database. I work for Cigna, so they couldn't even pull our rates from our rate table on Google on some sort of anonymous basis. Very rarely.
Right.
Even the way we capture leads, we have to protect and manage the lead capture. We can't allow any third party to just sort of capture our leads on our behalf.
Yeah.
Yeah.
And the other carriers are faced with similar issues in the UI, UX period design on the front end, where gathering that information allows them to give a quote. You'll notice that if you get any quotes, whether it's a life or auto or health, it's always preliminary. This is a preliminary quote. There's lots of information under the disclaimers on the bottom, referring to the fact that underwriting, which still is a process that occurs afterwards, which involves all of that personal
But
information.
there's no underwriting no more. Let's just get that off the table. 10-1, that goes away. New law. So there's no underwriting agent. You don't have no actuaries anymore. That all leaves our stratosphere. So that's the way we operate now. But after the new law, that's done.
So no morbidity tables?
There's what he's talking about is a rate up. So what happens is there's an initial quote, and then they do like they look at your medical history and they see, oh, he actually has all these diseases or whatever. Now we're going to give you the official rate, and that's the one that you actually commit to. But that disappears with the new law. So it's a flat fee-based system with these metal plans. So there's no chance of a rate up. You don't get like the bait and switch deal that you have now. So.
Yes, that's right. And right, because of the also no longer excluding, being able to exclude for pre-existing condition. Right.
So that's you can't get rejected.
Critical factor.
Everyone's accepted.
Yes.
Yeah.
Any other questions? If not, I highly recommend you insure your fainting goats if you have any. And feel free to contact us.
Minors will be jumping on trampolines, so.
Right.
Thank you very much.
Further differentiate your brand.
Nice to meet you. It's uncanny because I applied for a lead market in New York City. No, not in. Yeah, maybe.